Pain and scoliosis can be hit or miss. I have severe cases with no pain and mild cases with a lot of pain and everything in between. In my clinical experience, here are the 3 biggest contributors to scoliosis pain. Spinal rotation is number 1, and it plays a major role. Pain and scoliosis often comes from the 3-dimensional nature of the deformity, not just the sideways curve. And as the vertebra twist, muscles on one side of the spine become overworked and tight, while the opposite side is lengthened and weakened. This imbalance increases fatigue and strain, particularly with prolonged standing, sitting, or repetitive movements. Rotation can also alter rib positioning and joint mechanics, creating an uneven load distribution through the spine that leads to chronic discomfort and localized pain. Sagittal and coronal imbalances is number 2. And they further contribute to pain by disrupting the body's ability to stay aligned over its center of gravity. In the sagittal plane, which is from the side, loss of normal curves or excessive lordosis or kyphosis forces muscles to constantly work to keep the body upright, increasing muscle tension and joint stress. And in the coronal plane, which is from the front to the back, the head and torso may shift off center over the pelvis, causing asymmetric loading through the discs, the facet joints, hips, and even the lower extremities. Over time, this uneven stress can accelerate degeneration and amplify pain during everyday activities. And number 3 is spinal instability. It adds another layer to scoliosis-related pain. When the vertebrae lack adequate support from surrounding muscles and ligaments, small repetitive movements can irritate joints and discs and nerve structures. Instability often triggers protective muscle guarding, which may temporarily increase stiffness, but ultimately worsens pain and fatigue. Together, rotation, imbalances, and instability create a cycle where the spine works inefficiently. Muscles overcompensate, and pain becomes a persistent part of daily life, rather than an occasional symptom. It is a complex puzzle, but at ScoliCare Louisville, we can help, and we're dedicated to helping you sort out the pieces. In the next 3 videos, we'll be covering these 3 topics in more detail, so stay tuned.